Good afternoon, everybody. Bob Brisky here with Pinnacle Financial Services. Welcome to our webinar presentation. So today we're going to talk about Connect4Medicare. We're going to talk a little bit about the plan finder over at Medicare.gov. Of course, we're going to go through a bunch of different stuff that's really important and hot, especially this time of year. Let's hit a couple of quick housekeeping items first. As you can tell, everybody is on mute right now. We've got over 300 agents registered for this webinar, so we're going to try and keep all that background noise out of this. So everybody's on mute, but in the dashboard there, you can ask questions. Just feel free to type in a question. I will, during the presentation, take a look at the questions as I am getting them to make sure that we're getting all of those answered. We are also going to be recording today's presentation, so if you would like a copy of the recording, you can feel free to just put that note into the question box as well, and then once the webinar is completed, I'll get that information out to everybody looking for a recording of the webinar also. I expect we're going to run maybe half hour to 45 minutes today, depending on the questions that we do end up getting here, and then we'll send everybody on their way. So let's dive right into it. So first off, I think it's important to know that here during AEP, we are going to, of course, do a lot of business. And one of the most important things to do during a short time frame that AEP is to work efficiently, right? Work smarter, not harder. We've all heard that before. So let's talk a little bit about Connect4Medicare. So Connect4Medicare is Pinnacle Financial Services online enrollment tool for Medicare Advantage, Medicare supplements, and the Part D prescription drug plans. So this tool is going to allow you to compare clients. It's going to allow you to give quote comparisons, and the beauty of it is also going to allow you to enroll individuals into the appropriate plan for them during this upcoming AEP. So as you can see, you're looking at the Connect4Medicare site here right now. But what I want to do, I want to start actually on the Medicare Plan Finder, because this has just been more of the hot topic here. Obviously, the Plan Finder, most of you on this call, I'm sure, are aware. They changed the Plan Finder. Put it this way, it needed a facelift, but I don't know that they talked to a lot of agents when they really looked at the functionality that was important. So here is the current 2020 Plan Finder. So everybody should be able to see this is live and in action right now. So you can go to this Plan Finder right now and run 2020 comparisons on there. And I'm going to walk through one of those here today. So first off, you have two options when you get to Medicare.gov and you got a Plan Finder. Your clients, have the option to create an account. If they had created an account previously on the existing or old Plan Finder, they can use the same credentials. That information is still okay as far as logging in purposes. If they have never logged in, never had an account, maybe you're usually the one who's running stuff for the clients, which I think is what I hear a lot of, is that the agents are doing their job, right? You are helping your clients walk through the process and using the Medicare Plan Finder tool to make that happen. And that's what you've been doing over the last couple of years. So what I want to do here is I want to look at what I think most of what goes on is that individuals are not creating an account, and insurance agents, professionals that are in Medicare, are helping those individuals that do not have an account currently set up. So right here, you can see continue without logging in. So let's click on that. You can see, answer a few quick questions here. What type of 2020 coverage are you looking for? So I'm going to just start with the Medicare Advantage, right? AEP is right around the corner. Let's take a look at the Medicare Advantage plans here. Let's pick a zip code. I'm going to do 18974, which just happens to be our zip code here at Pinnacle Financial. I'm going to say we don't get any help. So this is an option if you have somebody that's a dual eligible, for example, they're Medicaid, they're getting partial assistance. These are questions, of course, that you have to make sure you're aware of when you're doing these type of comparisons. But for the sake of keeping things simple, I'm just going to say I don't get help on any of these programs. Next. Do you want to see your drug cost? Yes, we do. Let's do the drug cost. How do you normally fill your prescriptions? Retail, mail, order? I'm just going to say, let's just say both. Next, we have to pick a couple of prescription drugs, right? So let's just pick a couple. Let me add a drug here. I'm going to add that to my drug list. Let's just say I want to add another drug. I'm going to add Toprol. Let me say to add. This option is to add a generic. Let's just say I'm adding a generic. Add that to my drug list. So you can see here pretty quickly and easily I've added a couple of prescription drugs for the client. So I'm going to say I am done adding my prescriptions. Now there's an option to add the pharmacy. Of course, as you all are aware, have done Medicare Advantage and prescription drug plans previously, pharmacies matter. Are they a preferred pharmacy? That could make the difference on what kind of out-of-pocket costs for prescriptions your client is going to have to deal with. So let's just say we're going to pick a big chain, right? Let's just pick CVS. I'm going to hit done. And just that quickly, 62 Medicare plans available. So in Bucks County, in my zip code, 18974, I've got 62 plans available. First one that is showing here is Lasso Healthcare, AARP, United Healthcare, Allwell. So what kind of order is this being placed in? Right now, plans are being sorted by lowest monthly premium. See this little drop down here? Right now, it's sorted by premium. So you can see all of our zero premium plans are showing. I can do yearly drug deductible. So is there a deductible? For example, on this MSA, there's a big deductible. Here's Medicare Advantage from AARP. There's that deductible. How about health plan deductible? Right? We're going to put them in order from lowest to highest. Here we go. Zero health plan deductible. Zero health plan deductible. Zero health plan deductible. How about lowest monthly premium, which is what we start with? We'll go back to there. So what you see is we don't have an option, is that it's not going to give you the lowest out-of-pocket cost for your client. So take into account the premium for the plan, take into account the overall prescription drug cost for the individual. So we picked two prescription drugs here. So lisinopril and Toprol, what kind of out-of-pocket costs for those prescription drugs? And then also, is there any type of deductibles in the plan? So right now, today, the Medicare Plan Finder will not total all those out-of-pocket costs for you, for your client. So you're looking at this, the info's here, but look, there's 62 Medicare Advantage plans. If you've got to go by hand to figure out what's the lowest out-of-pocket cost for 62 plans, if you have to manually do that, I got to tell you, you're going to have to really increase the length of your appointments with these clients, because there's 7 pages of plans here. You may find, using Medicare Plan Finder, that until you get to page 5, you might not even find the best plan for your client at this point. What's the lowest total out-of-pocket my client's going to spend based on their situation? It doesn't give it to you right now. Now, I will tell you, there's been updates coming from CMS that type of functionality, they're looking to get it back into the system. There's been a lot of dialogue on it. As you can imagine, the individuals at CMS are hearing it. They're getting beat up. Organizations like NAHU have just been beating the heck out of them, saying, you've got to give this functionality or else you're almost making this plan finder unusable for agents to help individuals find the best plan for them. And that's where we are right now today. It doesn't give you that functionality. Short of you going through 62 plans and manually calculating what the best plan is for your client, it's going to be real difficult for you to do that. That's not good news for anybody, especially during AEP when you need to work smarter, not harder. You got to be efficient. And at the end of the day, you want to make sure you're picking the appropriate plan for your client, because come after January 1st, so everybody knows that OEP is back. Last year was the first year, so your clients could actually make a change if for some reason there is an issue with the plan that you picked. And we certainly don't want to have that happening. So here's where Connect4Medicare, Pinnacle Financial Services, our tool is going to be of a huge impact for individuals working this upcoming AEP. So what I'm going to do, I'm going to shift out of Medicare Plan Finder here. I'm going to go back to our Connect4Medicare. So this is our landing page, and you can see right here it says 2019 site, and right below it, 2020 site. So if you have individuals that you're enrolling that are requesting effective dates in 2019, you go to the 2019 site. But for example, for this upcoming AEP, anybody looking for 2020 effective dates, you want to see the 2020 plans, you've got to go to the 2020 site. If you worked with us and you used Connect4Medicare in 2019, you have access to the 2020 site. You're already set up. If you're not sure what your login credentials are for the 2020 site, just reach out to us here at Pinnacle Financial, and we'll make sure we get you logged into that. But as of today, as of a week ago when this rolled out, you should be able to go in there and look at all the 2020 plan information. And that's what I'm going to spend time on today, which is the 2020 plan site. So here's Connect4Medicare 2020. Those of you who work in 2019, it looks exactly the same. Up here in the URL, you can see I have 2020. So this is the 2020 site. I am going to log in. Okay, we are now logged into the 2020 site. I'm just checking out questions as we're going along here. Okay, so Connect4Medicare. The first thing you're going to see is the dashboard. Now, this is our training site, so there's really no completed enrollments on here. This is just for us for training purposes. If you had completed enrollments in your Connect4Medicare login, you would see information on that here right on your dashboard. Up at the top, you can see View Dashboard, Search Profiles, Start a Consultation, Start New Enrollment, Send a Quick Quote. All these are things we're going to go through here on the call in a minute. Search Profile. So you've added somebody into the system. Anybody that you've added into the system in the 2019, for example, is still going to be available in the 2020 site. That's one of the things that's really beautiful about Connect4Medicare is if you enrolled somebody last year, for example, you'd be able to actually have their information in the 2020 site, and you'd be able to just run the new plans for 2020 to see if they need to stay where they are, or maybe they actually need to move into something else. You can do that comparison, and you don't have to re-enter their info if you previously had entered them into Connect4Medicare. But let's just say that hasn't happened. Let's just say this is a new client. They've never been in Connect4Medicare. You're working with them. You start a consultation. All right, everybody knows what the asterisk means, right? That is the required information. I always tell agents that I'm working with, and when I do these trainings, that I would put in as much information as you know, even if it's not asterisk, because anything that you put into the profile gets saved first off, which is great. Now that info is saved in there for you to reference, but also anything that's in there will actually move forward with you throughout the process. And even when you get to a point where you're going to enroll that individual, if you've entered their address already, if you've entered their phone number already, that information will move forward and you won't have to re-enter it. So I'm just going to do a quick fictitious client here, we'll say. Again, I'm going to pick 18974. That's Bucks County, Pennsylvania, for those of you keeping score. All right, phone number, I'm not going to put that in there. Let me just pick PA. Okay, so I've entered the basic information. I hit continue. Scope of appointment. So right here, you have the option. If you want to do an electronic scope, you can do an electronic scope. If you do an e-scope, a PDF of the completed e-scope will also be saved here. So this will also be a repository for you as the agent to have a record of the scopes that you did. Some of the carriers, as you know, United Healthcare, for example, they do not even want you to send them a copy of the scope. Unless there's an issue, you're still required just to keep it on file for 10 years. But a lot of the carriers, they just don't even want to see them. So this is a good way for you if you're doing e-scopes to just keep it in the file. And if you ever need it, it's there. You can print off a PDF version of it. If you want to save a copy somewhere on your computer, you can do that as well. But this is a nice, easy way to do an e-scope. So, of course, you don't have to do an e-scope. If you do a paper scope, you can actually skip this. It's not going to keep you from doing a quote. Okay, zip code 18974. That's what I already entered. Age range, so 65 to 69 based on the date of birth that I entered. How is your health? So good health, fair health, poor health. So what we have here is that CMS uses some data that they have that has to do with if you're good health versus fair health versus poor health, how many times you go to the doctor. CMS uses that data. And then when you do the actual comparison, it's going to say for somebody with poor health, your costs are going to be higher because you've utilized it more. You're going to the doctors more. Maybe you're on more prescriptions. Maybe you're going to a specialist. If you're in good health, even though it's the same plan, you're not doctoring as much, maybe it's going to reflect a lower total cost throughout the year because, of course, you're not utilizing your health care as much. But bottom line is whether you pick good, fair, or poor, it's not going to change the plans that show up. It's not going to change the benefits of the plans. It's still the plans are the plans. So I'm just going to leave it in good health and hit continue. All right, just like the Medicare Plan Finder, do they get extra help? Are they on Medicaid? Are they on LIS? Do they receive 25%, 50%, 75% partial health? So for this example, I'm going to do the same thing. I'm just going to say not getting any extra help. Just keep it simple as we're moving along. Hit continue. All right, here's the prescription drugs. Just like the Medicare Plan Finder, I'm going to put in lisinopril. Here we go. Add that prescription. And I'm also going to put in Topril, just like I did previously. Use brand name drug. Same exact option I have with Connect4Medicare that I had with the Plan Finder. Here we go. These are the two prescriptions I did on Plan Finder. I'm going to keep it the same. I'm going to just do these two different prescriptions. Keep it simple. If you got to enter 10 of them, you can enter 10 of them. Again, the nice thing about this is that once you enter these prescriptions into your client's profile, it saves the information in here. And it will save it year after year. So next year, if you have a client on multiple prescription drugs, you're not going to have to re-enter them. Mr. or Mrs. Jones, did your prescriptions change? I show you on lisinopril. I show you on Topril. Is that correct still? You're good to go. Drug list is complete. Now it's looking for a pharmacy. Seem familiar, right? Same thing as the Medicare Plan Finder. Now I'm just going to pick CVS. Same exact pharmacy. Hit continue. And bang, here you go. Here's your view and compare plans. Right now, I'm on the Medicare Advantage prescription drug plans, right? This is our test site, so just remember, not being a live version, I've got some of the plans loaded into here for you to view. It's really important to know that this is an enrollment tool. So you can see under each plan, there's a little enroll button. So anybody in our Connect4Medicare can actually enroll a client into a plan. So here at Pinnacle Financial Services, we are really very high on compliance. And one of the things we need to make sure is that you as an agent are able to sell the plans that you are licensed and have done your certification. You are ready to sell, as we call it. If you are not ready to sell, or here at Pinnacle, we don't know that you're ready to sell, we can't actually show that information to you because we can't have you accidentally enrolling somebody in a plan that you're not ready to sell. So that's one of the things on the back end that we do to make sure that you are compliant. It's really important to us to make sure that everything that you do is compliant. CMS is really very high on that as well, as everybody knows. So right now you're seeing 34 different plans here in our test site. You've got Cigna, you've got some Humana, you've got United Healthcare, you've got Aetna in here, you've got Allwell in here, Independence Blue Cross in here, and we'll just keep going down. You can see there's a ton of options. But what's different about our plan finder than what was at the Medicare, or what's different about, I should say, our Connect for Medicare than the Medicare plan finder is look at our drop-down menu. Right now, we're looking at total estimated cost. This is what the plan finder does not have right now, right? What is the total estimated cost that your client is going to have for the next year based on the prescriptions that they're on, based on any deductibles that there might be, any copays? What is the total estimated cost? Here's the drop down. You can still sort by plan premium. If you want to look at all the zero premiums, great. You can do that. But I think the most important way to be able to look at the plans is to look at the total estimated cost. And you can see this Cigna plan in our Bucks County zip code here at Pinnacle Financial, based on the fact that we put in lisinopril and topril, is going to come out with the total estimated cost of $1,264. That's total cost. That's everything. Humana, $1,380. United Healthcare, $1,471. You can see there's an Aetna here, $1,572. You can see how the premium, right? It's not sorted by premium. It's just sorted by what's the best plan for your client. That's what's important. At the end of the day, how much is my client going to spend on their health care, right? That's what we want to know. That's what's important. So let me check. I'm going to check out questions right now. If you give me 1 second here. All right, so there's some different questions here. I'm going to hit a couple of them here. I'm going to try and go along with the questions before we get too forward. Okay, the first question, can we see when a client signs a policy? So there's a couple of ways you can actually do an enrollment with Connect4Medicare. So you can do an enrollment face-to-face with Connect4Medicare. So a client's actually there with you, and you're showing them this information, say on a laptop, or they're in your office, and you're showing the information to them. Maybe you've got a big screen TV where you're using it as a monitor, or you're just turning your desktop version around for them. So you can do these face-to-face. So if you do them face-to-face, obviously the client's there. It's just an e-signature. They really are just clicking a box. Those of you who have done e-signatures for other things in the past, all you're really doing is clicking a box and e-signing the application. So not only does the client just have to click a box, but you as the agent clicks a box to sign it as well. So it's just that simple. Now you can also do a sale over the phone. So if you're doing it over the phone, it's a little bit different. It's a little bit different, obviously. So when you're doing something over the phone, let's just look at enroll. So the enrollment's not open until October 15th, but so what happens when you're enrolling over the phone? It's going to send an email to your client. They're going to click on that email, and they're actually going to have the application open up, and they're going to be able to e-sign remotely. You get notified via email when that's done. So you get notified as soon as that's done as well. So if you're working over the phone and it says an existing client, and you're saying, hey, John, listen, you're in Cigna right now. We got to switch you over to Humana. I'm going to send you over a link to complete it. The plan's better this year for you. You could be on the phone with the client while you're doing this. Make sure that they're able to open it up. It's very simple. It's just a link in an email that they're going to click on. So it really gives you a great way to actually to work with the client. So it's really important that that you know there's a couple of different ways you can actually do these. All right, so let me take a look at further questions here. 1 second. A lot of the questions are duplicating themselves, so I'm just reading them. We got quite a few here that are just simply duplicating themselves. Okay. All right, so let me move on. as we're going here. Again, I'm going to keep looking at the questions. So as you have more questions, another one just popped up. Yes, this is Bucks County, Pennsylvania that we are showing. If there are SNP plans, special needs plans available in your area, they should absolutely show for you when you're doing these enrollments. If you find that when you log into your 2020 site that you think a plan should be showing and it's not showing, reach out to us here at Pinnacle Financial and we'll double check that plan information. Obviously, all the plans have changed from 19 to 20, so there's a lot going on behind the scenes. There could be a reason for that. So feel free to give us a call. Our number is 800-772-6881, extension 7731. Again, 800-772-6881, extension 7731. And just ask about whether or not a certain plan's showing up, and we'll make sure that if it's supposed to be, that it is there. All right, copy of the recordings I am going to get out. Drug list. Let me show you. Yeah, this is a great question on the drug list. Let me show real quick here. Prescription drug plans. So I switched over from the Medicare Advantage tab to the prescription drug tab. So let's say your client's on a Medicare supplement and you're just going to be working with them on a Part D plan. You can do the enrollment right through the system on the Part D plan. You can see here we've got Envision showing, WellCare, Humana, SilverScript, which of course you're aware is Aetna's plan this year, right? United Healthcare. These plans are all showing. You can see there's an enroll button there, so you're able to enroll them. And here it is, total estimated cost. Same thing. It's going to take lisinopril, it's going to take topril, and it's going to say which plan is the best for your client. It's going to take into account the premium, any deductibles, and any co-payments that might come into play when you're working with a certain plan. You can also compare plans side by side, so you can compare up to 3 plans. So side by side, you can compare these 3 plans. Pharmacy directory, you can look up pharmacies. You can also do the physician finder. So what have you had to do historically? You walk into a house, you're working with a couple of companies, you're not sure which is the best plan for your client. You've got the information on Aetna, Humana, and United Healthcare, just for example's sake, and you decide that the plans are pretty close to each other, but what else do you have to look at? You have to look at physicians, of course. Which physicians, which specialists are in the network. So here's a way to have every single physician finder in one spot. So you don't have to go to United Healthcare's site. You don't have to go to Aetna's site. You don't have to go to Anthem's site. You don't have to go running all around, keeping track of where you find all these physicians. You can actually do it right here through the plan finder. Here you go. And you can see right here all the different plans. You want to find out about them, you can do that really very easily through the system. So it really is a one-stop shopping when it comes to just finding all the information out about these different plans. All right. If you also want to take a look at some of the details in the plan, so let's take a look at view details under the Envision plan. Let's dive in a little bit more. You want to see estimated cost per month. You can see right here, lisinopril, it's broken out. Here's the estimated cost. Topril, here's the estimated cost broken out. Here they are, nice and easy through the CVS pharmacy. You want to take a look at the mail order pharmacy. I'm sure this looks very familiar for those of you that have done the plan finder, the old version in the past. This information is very much the same as it was on the old plan finder, which I think is very, very user-friendly. So all this detailed plan information is right here in one spot that you can definitely do all of your clients' information. So let's take a look at, I'm going to go back to our results here. Okay, so this is our results page. Medicare supplements right here. So let's just say you are going to do a Medicare supplement. Let's say you want to write United Healthcare for example, and you're going to do an Envision or a WellCare PDP, you can do all these enrollments right through our system as well. Some of the agents I know have done a lot of these comparisons, and maybe you don't have the ability to do electronic applications. Maybe you don't have that that connection. Or you like doing paper apps. That's fine. You can use this as a resource as well. You get access to this no charge through Pinnacle Financial Services. This is free to all of our agents. We do not pay for you to have access to this. We just want to make sure that you're working smarter, not harder, working efficiently, making sure that you're seeing as many people as possible. You get in the house, you're able to give all that information. You're the expert. They don't need to see anybody else because all the information's here. They don't need to shop on their own. You're able to give them the best possible outcomes. Let me look at the questions again here real quick. There's a question about doing a drug comparison for a client without including the client's information. The only thing you need to do, you do need to have a profile. So you need to have a name and you need to have a date of birth. Is pretty much the required information. As long as you put that in there, it's going to allow you to put in prescription drugs, and then you're going to be able to do a comparison on there. So you don't have to go do a full-blown profile to do comparisons on here. If you're not worried about adding prescription drugs, that's where you can do something like a quick quote here. So if you do a quick quote, you can just put in a zip code, and it'll give you just the plan information, everything that you're seeing here, but of course, it wouldn't take into account any prescriptions that a client's on. So you can do things like that as well through the system. So looking at the questions here. There's a question about what type of plans you'll see through our Connect4Medicare. Just remember, you've got to be contracted with Pinnacle for the plans. We use the carrier ready to sell report to know for sure that an agent is absolutely contracted and good to sell a plan. So I hate to say this, but it's just a fact of life here with Connect4Medicare. If you're not contracted through Pinnacle for a plan, you will not see that plan on our system. So if that's something you really think is important, if this plan is something you say, hey, listen, I got to have it and I got to have all my plans on there. Again, you got to call our sales team and see if we can get it worked out where you're working through Pinnacle Financial for those plans. Again, our number here is 800-772-6881, extension 7731. Okay. Just looking at questions here still, 1 second. There's a question about the summary of benefits. Summary of benefits and that information is definitely on here. So I'm back at the Medicare Advantage plans. If I hit view details, right under the first option, which is Cigna, right here at the bottom, you can see the 2020 summary of benefits, right? All that's here. There's a Spanish version of it. Evidence of coverage. Here is the PDF of the formulary. All this information is right here. Provider directories for the plan. So it really drills down. It's everything you need to sell in one spot. I can't emphasize that enough. There's too much going on with Medicare these days. These plans are not commodities any longer. There's too many different options. There's too many additional benefits. There's too much going on. There's new plans coming in. There's plans leaving the marketplace. If you want to really be able to work effectively and have your best AEP, you really need to have some type of tool like this Connect4Medicare to make sure that you are given the best possible information as quickly as possible. Making sure you got a husband and wife that you're able to see 5 people a day, not 2 a day, right? That'll make all the difference. So you can see here, let me look at some questions again. I'm sorry, they're popping up fast and furious. All right, which is great, though. I love that. All right, I want to go a lot of duplication on questions, but let me go right now. Under everybody who's got access to Connect4Medicare, Whether you realize it or not, we have actually given you a free Medicare enrollment site. A free, absolutely 100% free, client-facing, compliant site that an individual can go to that site. You don't even need to be involved in the sale. If they go through and do a comparison and they enroll in a plan on their own, you actually get credit for it. It's tied to your NPN number. That site will, again, only show the plans that you are ready to sell. You're licensed and ready to sell with Pinnacle Financial Services. Again, I can't emphasize that enough. So let's take a look. If you go under My Account, you can see this little copy button. If I hit copy, I am going to paste that URL. Finding the right plan. This is a consumer-friendly site. So those of you that have not worked with websites before, our team here at Pinnacle Financial can help you set up your own domain. So you can go to places, for example, like GoDaddy, and you can buy a domain. Let's say here in Pennsylvania, I want to purchase PAMedicareplans.org, and I want to tie my free Pinnacle Connect4Medicare website to PAMedicareplans.org. There's a way to do that. Now, domains vary in cost. Typically, maybe $10 a month it's going to cost you. You can tie your free site to it. So if anybody goes to PAMedicareplans.org, they're going to come to your page. This has Kevin Shields' information, which is our test site. It's going to have your information here. And they can actually do comparisons of the plans just like we walked through. So they can actually hit Get Started. Let's just say they want to view all the plans. Put in a zip code. Hit Submit. $34 plans available. Look familiar? Right? Same amount that was on the broker site. And this is a client's ability that if they wanted to, if you were driving traffic to PAMedicareplans.org or whatever the domain was, if an individual went out there and they saw that, hey, Cigna's got the best plan for me, they can actually add it to their cart, right? The old Amazon style, everybody's familiar with add it to the cart, right? And they could enroll right in that plan. Now, they couldn't do it till October 15th, of course, because it's not open till October 15th, right? Now, a client also has the ability, if they want, they can actually enter their prescription drugs in the same way that you and I just walked through adding some prescription drugs. Okay, so we're going to hit Get Started. And I'm going to pick Help Me Choose. So a few simple questions, right? 18974. I'm going to look for medical and drug cost. I'm 65 to 69. I'm in good health. I'm not getting any extra assistance, which again is something the client would have to know. They can actually hit I don't know if they're not sure. Hit Continue. What are their plan preferences? Low premium, low out-of-pocket cost. I want to keep my own doctor. I don't see a dentist more than twice a year. I'm not worried about vision coverage. Here's where they could actually add prescriptions on their own again. Let's just say the only prescription they're on is lisinopril. My drug list is complete. They can actually say which pharmacy they go to. They go to CVS. Hit Confirm. They can confirm all the information is correct right here. Hit Continue. And here you go. One of one drug is included. Now that lisinopril, which I entered, is there. Total estimated out-of-pocket cost. Again, the most important information that you or a client needs to know is how much is the plan going to cost me. Don't just give me the premium. Don't just give me the drug cost. Don't just give me the deductible. Don't have me pull a calculator out and have to do a math on 34 different plans. Give me the info, make it easy. And that's what this system's going to do. So now if they wanted to add this plan to the cart because it's the cheapest one, they could do that and they could enroll. Your agent of record, you get paid. It's that simple. Now, you've got to obviously set it up where you're driving traffic to a site. That just doesn't happen in a vacuum, and we can talk to you a little bit about marketing and how to make that happen, and if you want to go down that road. So there's definitely ways that you can enhance your website attractiveness to potential clients. But the option's there, no charge, it's yours. All right. So I went back to our broker site here. Let me check out questions here real quick again. So the question about the URL and a domain setup, call sales here at Pinnacle Financial. It's 800-772-6881. Dial extension 7731. Again, 800-772-6881, extension 7731. And talk to them about getting a domain set up for your site. And they can help you walk through how to do that. Really easy to do that. As a matter of fact, if you want us to walk through the GoDaddy, we're pretty adept at doing that at this point, so we can help you out there. Let me look at the questions. Can the URL link be used in an email? Great question. Marketing rules changed as of about a year ago. You can actually now e-blast individuals, and you can send them the URL if they sign up. Hey, that's important. That's important. So always obviously you've got to make sure that the client's picking the right thing. So you want to have the tools available. I would tell you 99% of what you're still probably going to do is sales. You're going to have to talk about costs. You're going to have to talk about, whether the doctor and the hospitals are in the network. I mean, listen, we all know that a doctor has to be in the network. The hospital's got to be in the network. And you're looking at the plan that's most competitively priced. That's all part of this. The beauty of the Connect4Medicare is that you're going to be able to do all that in one spot for all the different companies that you're contracted, at least through Pinnacle for, right? And that's some things we got to think about whether or not you want to have all your plans available through the Connect4Medicare site. So really important. Still looking at some questions. Hold on one second. If you want to compare different pharmacies, the one thing you have to do with Connect4Medicare is that you have to select a pharmacy and you can go back and change that pharmacy. The Connect4Medicare right now does not allow you to pick multiple pharmacies. Question about editing the drug list. Real simple to edit the drug list. You simply go back to the client. You simply go back to their prescription drug tab, and you can just change those really easily, and it'll update it in seconds. It's one of those things where you got to do it a couple of times. Does that make sense? Like anything, once you go through the system once or twice, you really see how easy it is. You're seeing me do a lot of these things. Our sales team here will even do one-on-one walkthrough specifically for you. I know a lot of what we do in these webinars is a little bit maybe 30,000-foot view. For example, I didn't really walk through an actual enrollment here for time purposes, but when you hit enroll, it just takes you to an application. It's an online application. You put the name, the phone number, the address, everything you put in has been moved over. You go through normal application questions. You click a box for the e-signature, and you're done. It's really that easy. So there's some of those really other type of things. If you really want to go walk through those, got to get with the sales guys here at Pinnacle Financial. So numbers 800-772-6881, extension 7731. If you want somebody to reach out to you, feel free to put that in the message, put it in the questions. I'm going to go through that after the call here today. I'm going to make sure that everybody who wants a copy of the recording, anybody that maybe asked a question that I missed, gets their questions answered. We've still got a week or so, give or take, right, to AEP starting. So you've got time to get yourself up and running with Connect4Medicare. Just keep in mind, I would get into the system before October 15th if you're going to use it. It's better to learn it now, make sure you're up to speed, It's real simple. Probably take you no more than maybe one or two tries, and you'll be good to go. We're right about 45 minutes, so I'm about the amount of time I want it to be. I did record this. The sales team's ready to help out. We're all hands on deck here for Connect4Medicare and the an AEP coming up here. So whatever it is you need to be successful for the upcoming annual enrollment period, we want to definitely make sure we're helping you there. Whether it's getting supplies, doing marketing, lead programs, or Connect4Medicare, whatever we can do here. So I'm going to end it here, and hopefully you got a lot out of this. Ran through a lot of information quickly. We're going to get the information out to you. Anything you need, feel free to reach out to us. So again, for Bob Brisky and the whole team here at Pinnacle Financial Services, we really look forward to working with you for the upcoming AEP and beyond. So hope everybody has a great rest of their day, and we will talk soon. Thanks, everybody.